Welcome, everybody, to the Integrative Palliative Podcast. I am so excited today to have a really special guest. We have Dr. Mary Jo Fishburn, who is a physiatrist and specialist in musculoskeletal wellness, and she's going to explain to us what that means. Welcome, Dr. Fishburn.
Thank you so much, Delia, for having me.
I'm very happy to have you. So can you just start out by telling us a little bit about you and your background and your practice and the work that you do?
I'd be delighted. So my background is the specialty is physical medicine and rehabilitation, which focuses on function. And that can be a variety of aspects of function. But for my interest, it's on the ability to move in the world with ease and accuracy, and to find balance in your life. So I started at Hopkins as a attending. I worked there for 11 years, and then I moved into a private practice in Towson and began more of an integrative approach to things. So initially, while I was at Hopkins, I acquired training in osteopathic manual techniques, as well as acupuncture, and of course, a variety of more academic understanding of what impaired function. So I have all of that background knowledge that I can bring to someone who's having difficulty with being comfortable in their body. And that usually translates to pain issues, and most frequently spine, but can be any joint. It can be thoracic rib dysfunctions. And frequently people come to me after they have not gotten a whole lot of benefit anywhere else. And what I have found is the kinds of problems that people have are more easily addressed early. But in a chronic state, sometimes very quickly we can unravel some of the compensatory patterns that we develop in response to an injury, for example. And I'm deviating all over the place. I'm not very focused.
That's okay.
So let's start that over.
Oh, really? Okay.
Well, I mean, maybe cut out part of that. You can decide.
Okay.
So anyway, I got interested in initially when I went into private practice, my idea was that if I just work on balancing structure, things will get better. And what I found is that people would get temporary relief, but the pain patterns would typically recur. And as I started to explore what was going on, I became much more attuned to the fact that we all have postural habits. We all have patterns of movement that take us out of balance. And if you don't address those habits, then you're going to have a recurring problem. The other aspect of things is how aging and cumulative events impact individuals. So I began to look at the storyline of what was going on for people. And frequently, what's surprising to many people when they have a pain issue is they'll say, well, all I did was blah, 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 something small, and now I have this big pain issue. And what we forget is that our adaptability, our resilience is a cumulative state, that all of the experiences we've had in the past that we've adapted to, that we've been able to accommodate to, limit our ability to adapt to this one unless we have restored a balanced, more flexible, supple state. So my focus became more on more of the biomechanics of movement, and also understanding what was triggering inflammatory patterns, because sometimes you might get somebody in a pretty good place, but they had chronic inflammatory issues. And that took me down the path of a functional medicine perspective, looking at gut health, at metabolic factors, hormone imbalances, the impact of stress, and the quality of sleep, what kind of circadian rhythm someone has. All of these things impact physical health. And not the least of which is the emotional milieu in which you are living. So if you are super stressed, or you hate your job, or you're burned out, or you're in a really challenging relationship, or you just simply don't like yourself, all of that has a huge impact on how our molecular messengers, our internal homeostatic mechanisms are playing out, and generally there's a big inflammatory response.
So what do you do about that? If you find a patient who you feel like has all of these dimensions that are contributing to not moving with ease or having pain, what do you do?
The first thing I do is I listen to their story. What was their health history? What was their childhood like? Because if they had a very traumatic childhood, that has an impact. They were fine until when? And often people can pinpoint, I was fine until I was 30 years old. And then when you dig a little deeper, you discover, oh, there was some traumatic event, something significant that happened in their life at that time.
Yeah.
So that's the emotional component of it. And if they have not been able to resolve whatever emotional impact that was, then they're carrying it forward. And that has a signature that affects everything, whether they're conscious of it or not. So it's first of all getting that timeline of the story, and then helping people, the individual, recognize what's going on in their life that really serves them, and what is interfering with their wellness. So a lot of what I end up doing is coaching.
Yeah.
So a big piece of the biomechanics is helping people understand that their posture is their relationship to gravity. And if you're off balance most of the time, are we surprised that you are having difficulty holding yourself up? So if we can get that, there's some very pragmatic strategies in that. So once somebody starts to really pay attention to the way they sit, the way they stand, the way they reach for things, they start to really notice, oh, there's a lot more flow and ease here. In terms of the inflammatory aspects, we might, depending on what other symptoms or issues are presenting themselves, we may need to investigate a little bit more in terms of gut health with a stool assessment, nutritional status. The typical standard American diet is not a healthy diet, right? So it's looking at all these elements, and then stratifying, prioritizing based on what seems to be the biggest triggers, what seems to be the biggest player in what's going on. If someone's having constant diarrhea or constipation, so let's say constipation, they're probably not able to detoxify very easily. So to look at what's going on with the autonomic nervous system and help restore that makes a huge difference.
How do you help restore the autonomic nervous system?
There are a lot of different strategies depending on what's going on. If it's constipation, and one question is it because the gut biota is loaded with bacteria that's constipating, and you need to clear that. But for somebody who's extremely stressed, the question of adrenal health and are they able to get the deep sleep that they need to clear the inflammatory mediators out of their brain?
Mm-hmm.
Are they able to find something that they can really savor and enjoy every day? Are they breathing deeply enough to clear what needs to happen in order to restore the autonomic nervous system? So a lot of times people don't really move their ribs, and the sympathetic nervous system begins in the thoracolumbar intermedullary cell bodies. It's from T5 to L2. And if you're not moving those ribs, you're not really giving neural input into that system. You're going to affect sympathetic tone.
So stress makes us feel tight in our chest and have shallow breaths, which feeds back that the body should feel stress, right? So
Tends to
breathe.
trigger more of a hypervigilant state, and you can't relax, anxious, that affects sleep, etc. So sometimes just simply by paying attention to rib motion and the diaphragm and getting that engaged can really make a difference.
So how do you do that? Are there any of these things that you can explain? I know we can't see you, we can only hear you, but any ideas of things you can share in terms of posture, in terms of breathing? What would you recommend that even the people who are listening try themselves or suggest for their patients?
Well, one thing that really can help someone sort out whether or not they're sitting in a balanced way is if they rock their pelvis back and forth. So if you, first of all, both feet need to be on the ground, same distance from your buttocks. If you have them on the ground and your buttocks is in and your pelvis is in neutral, meaning you're not arching your back, you're not slumping, then things can start to stack over that. If you're at a computer, the typical pattern of posture that happens is instinctive. What we do is, because we're relying on our vision as primary feedback for what we're doing, we tend to kind of drift forward with our head into the computer screen.
Yes.
And we start to, our arms are like out there, out in front, and where our shoulders are slumped, we're kind of, our thoracic spine tends to be slumped.
And our head is forward.
Our head is forward, and it's very difficult to get a good breath. When you're slumped that way, there's no room for your ribs to move. There's no, you can get a breath, but it's pretty shallow. So the key is to really think about stacking the structural elements of our body so that it's like blocks. So if we think about our pelvis, if we're sitting as the foundation, if it's in neutral and you think about the pelvis as a bowl, you want that bowl to be even. You don't want it to be tilted one side or the other. So you want an even pelvis. You want your ribs, if you think about your ribs as the thorax as like a bell jar, like a jar that you would hold over a block of cheese, for example. You want the bottom of that bell jar to float over your bowl of the pelvis, and you want your ears to retract or to move back over your shoulders.
I'm fixing my posture as you talk.
So that movement, that kind of just elevates things. And if what you'll notice if you're doing that is that it's a lot easier to take a deep breath.
It really is. My posture is terrible. I think I just fixed it, and it really is easier to take a deep breath.
Yeah,
that's great.
Great. So the other aspect of things is if you're on the computer a lot is we tend to keep our elbow, we tend to reach with our mouse arm or our keyboard, and our elbows tend to drift forward. And as soon as your elbows are in front of your center body line, your mid-axillary line, for those of us who are physicians, then your pectoral muscles, the major and minor, get activated. And that tends to pull us into that forward slumped shoulder position as well. And if you're not stretching out of that on a regular basis, then it becomes a pattern of tension, which keeps our head forward, influences our balance, affects our rotator cuff, because now the rotator cuff, which is all attached to the shoulder blade, is being pulled into an adverse relationship and is between the collarbone and the ribs and the arms. The angle of it is adverse, and it locks the shoulder into limited range because of the way the anatomy of the shoulder is, and you start getting into rotator cuff issues. So going back to like the basic neutral posture that we talked about, one way to test if your posture is balanced is to rock your pelvis back and forth. So it's like slumping and arching your low back, and see what happens as you're doing that. And if you tend to be on one side, which it seems like is pretty common, then you'll notice, I've got most of my weight on one sit bone. And if you can shift your weight so that it's more equal, that also is important in terms of side to side balance.
That's fabulous. And what this strikes me, I think, is what you were talking about before, which is if we have all of these dysfunctional patterns for years and years and years, and then we lift something in a funny way, all of a sudden we're injured and it seems like nothing, but it's because we've had these improper body mechanics and these terrible posture habits for a long time. Sets us up, right?
Right. Well, what's amazing, what's really completely fascinating to me and wonderful to work with is the fascia, the connective tissue that is fundamental to all of our structure. It is what creates the shape of the cells. It wraps the cells. It organizes it into tissues. It creates the layers that allow glide and movement of the various elements. And there are groups of muscles that tend to work together with certain activities. And if your body is in good alignment and balance, and you're using your muscles in a full range, then the fascia tends to be pretty fluid and supple. But if you have repetitive patterns, let's say you spend, 8 hours, not too far-fetched for most of us, 8 hours on the computer every day, and you're not actively opening your chest and stretching out your arms, you're going to start getting tension patterns that extend all the way into the wrist and hand, up the arm, into the shoulders, and up the neck. And it's fun to unwind that, because if you and to recognize that an issue that's coming up in the neck may actually be a problem with the wrist. And it may be because of the way you're holding your mouse, or some weird injury that you had and you've been posturing a little differently, or cocking your wrists in a funny way. And so you've developed a tension pattern and never stretched out. So the opposing muscles tend to be weak and inhibited. And the more we use the muscles that are dominant, the more restricted we are. And again, it doesn't take much to really throw you out of balance. You don't have any, there's nowhere to go if you have that injury.
And so it sounds like what you're using to figure this out and repair these out of balance situations is manual medicine, osteopathic manipulative therapy techniques. Is that right?
Primarily, that's what I start with.
For people
That's
who
what I
don't
start
know,
with.
sorry, for people who don't know what that is, can you just tell them a little bit about what is OMT and what is manual medicine?
basically, there are many, many different styles of interventions, but the central goal of it is to restore balance around structures, and in particular around joints. So there's a range, and it overlaps with chiropractic techniques to osteopathic. There's nuances that have taken off in a variety of directions based on, the style of people who teach it. But I use primarily muscle energy techniques, which is activating. I have the individual activate their own musculature in resistance. I position the part involved into the place where there is restricted motion at the edge of that. And then when an individual activates their muscles, it releases the muscle tension that's restricting motion. So what we're trying to do is restore full range and motion. So for example, if it's a disc, an intervertebral disc problem, and focal, osteoarthritic changes and so forth that are happening there, generally what we're doing is we're looking at vectors that are impacting at that level. Why is that particular facet in so much trouble? And you need to look at long axis impact as well as local. So you can have a local spasm, if somebody swoops to the side and picks up a piece of paper wrong, that can trigger a rupture of the disc and focal spasm. But what more generally happens is, because we tend to be a little bit more asymmetric in the way we sit and relate to the world, as we're walking, we don't have that smooth transfer of the ground reaction force, of the recoil that our body experiences as we land on the ground when we're walking. And so what tends to happen, where there is a focused osteoarthritic change, is typically where that reaction force is stuck. So I liken it to, if you step off a curb that's taller than you expect and you land on a straight knee and you get that boing, that
Yep.
woo, it's jarring.
Yeah.
That's kind of what's happening on a micro level for individuals who are developing these bony changes. Our bones are living tissue. They're responding to how we're loading them. And if we can change the vectors of impact, we can change the pain pattern. We can reduce the inflammatory response at that level. And maybe that individual will not require surgery.
Interesting. So by positively impacting the way they hold their body, the way they move, you can change the impact. Is that what you're saying?
Correct. Yeah. And also there's really good data that shows that just simply by working on core strength, you can reduce pain. And guess what? That's changing the dynamics through the spine as well.
Right. It's so fascinating. I really am enticed by the whole manual medicine field, because in medical school, we don't really learn this much. We learn, if you have musculoskeletal pain, we look in your joint. Is it in trouble? Is it infected? Is there inflammation? Do you have something surgical? And if not, we just give you pain meds without looking at the muscular
maybe send you to
system.
PT, and PT may or may not be effective. That's the other thing, is that, the traditional physical therapist tends to be very focused in their treatment.
Right.
They tend to be less invested in looking at the long axis impact.
Yeah.
So if somebody has a knee problem or a hip problem, they're focusing on the pelvic musculature, but they're not correcting the foot mechanics.
Right. That's
They're
the
not
difference. I think that's
looking
really
at that.
important.
Mhm.
That is an important thing to point out, that that's the difference, because I think some physicians feel like, well, if it's some pain that's not surgical, send them to PT and that's the top of the line. And sometimes that's helpful. And some PTs have knowledge in the manual medicine field.
Absolutely. There's some excellent physical
Yeah.
therapists.
But not everybody, right?
Right.
Not everybody.
And it is shocking how little we learn in medical school about the musculoskeletal
I know.
system.
I don't understand why. They just left it out, essentially.
Well, I think it's sort of in the ballpark of like mental health as well, emotional health. And, I mean, there's a lot of ground to cover.
Yeah, it's true. So given that you brought up emotional health, that impacts pain too. And you did mention that a little bit early on, but tell us a little bit more
Hugely.
about how that fits into your work and the patients that you see, how you think you can help, et cetera.
Well, our emotions have a big impact on us. It affects us physiologically, it affects our sleep, which in turn affects our um, our circadian rhythm has a huge role in our inflammatory state. Um, it, I tend to look at the body as a web, as an interactive molecular soup. It's all hanging on a fascial, on a structural framework, bones and fascia and ligaments and muscles, all of that having a role. But we have cells that have growth factors that relate to each other, that are specific for that tissue type. But as a whole, our bodies are responding to three major systems: our neurochemistry, which our emotions have a huge impact on.
Yep.
Our hormones, which also has an emotional component. We know that women who are menstruating can have major shifts in their cycles if they're super stressed.
Right.
And the immune system and all the inflammatory mediators involved. So those there's a molecular dance that's happening all the time, that we're responding to what's happening internally and externally. And it's kind of incredible that we manage to exist at all. So I have that deep appreciation for just the incredible privilege of being alive.
Yeah.
And how magical and it is. And you can get caught up in all the different metabolic pathways. It's just astonishing when you start thinking about histamine pathways and methylation pathways and all of it. It's just like overwhelming sometimes.
Yeah. It's miraculous, really, right?
It is. And so much of that is in response to what we're telling ourselves, what we believe, and what our experiences generate thoughts, and we make decisions about those thoughts. We have emotions in response to the experience, and we decide things based on those emotions, and they become core beliefs that then change the way we relate to the world around us. And that gets reflected in our nonverbal expression. So somebody who's fearful is going to tend to be very self-protective. Yeah. They're going to tend to have their hearts kind of shut down, slumped, head forward, move a little bit more tentatively.
Right. Their body changes based on how they're feeling.
Absolutely.
Yeah.
And we know that there's a huge autonomic impact on all of that too. If you're fearful, you're in a fight or flight response. Your blood pressure is going to be elevated. Yep. You're going to be more pale. You're gonna, there's you can tell when someone's stressed.
Yeah.
It's in the color of their face.
And their
And when
muscle
they
tension is
relax, yeah,
different.
everything,
Right.
absolutely. And when they're relaxed and or joyful, dude, when you are with someone and they get good news and they relax, there's a blush that happens in the face. There's the vitality that returns.
Yeah.
It's amazing. If we pay attention to this, we don't have to question, is it real or not? It's real.
Totally, it's real. So, excuse me. So part of our musculoskeletal wellness is to attend to our emotional wellness too. It's all connected,
Absolutely.
right?
Yep. And
Fantastic.
how we treat ourselves. I mean, so much of our well-being has to do with how much we're driving ourselves, how much we're criticizing who we are, whether or not we like ourselves.
Yeah.
And having clear boundaries so that we're not constantly giving ourselves away. So
Yeah.
that's a lot of, so go ahead.
Let's say that one more time, because I think physicians have a tendency, some physicians have a tendency to have loose boundaries. And I love how you said that, and give themselves away and get depleted and then lose some of the joy in their work.
Absolutely. I mean, it's having had an experience with burnout myself. If you get to a place where you really don't care anymore, where somebody says something and you find yourself saying, who cares?
Yeah.
Then you really should be thinking about whether or not you should be there. But so I heard a quote from Prentice Hemphill that I love when we talk about boundaries. They define it as that space where I can love you and me at the same time.
I love that. Say that one more time.
Boundaries are that space where I can love you and me at the same time.
That's really powerful.
It is. And if you look at it, it's going to flex depending on who you're interacting with.
Right.
And how much you love yourself.
Right. So that's the thing we can work on too, right?
Yeah, well, that is the magic, isn't it?
Yeah, truly.
If you don't love yourself,
The
you
rest of it's
don't have a
harder.
whole lot of foundation to work from.
Yeah.
Yeah.
So before we close, is there anything that we missed that you think is really important for clinicians or anybody who struggles with musculoskeletal wellness, or anybody else to know? Anything we missed?
Well, I would say a couple of things. One is that if you, it takes time to have, to hear the story for an individual. But if we take that time, they will tell us what's going on, that they will tell us what they need.
Yeah.
And the challenge is that we're in a economically driven environment that really restricts how much time we have.
Yeah.
And if we're caught up with, trying to stay on target with our time, we miss those opportunities to really hear what's going on. And honestly, having the opportunity to be heard is incredibly healing.
Yeah.
So that's a big reason why I've decided to step out of the insurance basis of my practice and to move into a cash practice. The other aspect of things is that in my own personal life story, perimenopausal time. I had some major health. I had what I call the perfect storm. And so often, if there's a major health issue that happens, it's the perfect storm. And in my case, it was being perimenopausal, super stressed, unhappy in my marriage, mother of 2 children, working full time.
Yeah.
I fasted for 4 days in the woods with my girls camping.
Wow.
And I got parvovirus, and I lived in a house with mold. How about that?
Oh my goodness, that's the perfect storm. Gosh.
And that unveiled my genetic predisposition for autoimmune issues. All right. So understanding, wrapping it up, but the core issue, what it came down to, I mean, I did a variety of things, and I fortunately had some help from an integrative perspective. And really, this is what launched me more deeply into not only functional medicine, but on my own spiritual path. Is that at that point in my life, I really didn't love myself. Yeah. I was doing everything I could for everybody else. And I really had no idea what I needed. Yeah. I wasn't making that a priority.
I'm going to bet that a lot of people listening have that exact same experience.
And it is so critical to take time and the reality is that it really requires practice to get clarity, to identify what you need and what your truth is, and to get out of your own way. Yeah. Because if you're a physician, you've worked really hard to get where you are. And you know how to show up, you know how to be successful. But sometimes that's a hyperachiever that got you there. And while that's a gift, it also starts to be very self-critical and limiting. And it's hard to find joy if you're always looking to do the next thing, the next thing, the next thing. How about now?
Yeah. So what should people do if they recognize themselves and what you're saying? What should they do?
There's a lot of different strategies. I would say I have developed a secondary practice called the directed self to help those individuals who are awakening to this aspect of what's going on in their life and just need some clarity. What are the dynamics at play in relationships and in personal identity and where you feel, where you are in your life. So that has been really a joyful outcome of my perfect storm.
Yeah. Well, that's often how it is, right? Something really difficult happens and something blooms out of it. It's the flowers and the poop. Something blooms.
Yeah. So I have that as well. So I'm still doing the musculoskeletal hands-on, helping people figure out, is this a hip? Is this a back issue? What are my options? Those kinds of things. So the practical hands-on musculoskeletal aspects of things through my medical practice, and then really deep dive inquiry and exploration of what's going on beyond what's superficially happening in my life.
So how can people find you? If it sounds like if they're in Maryland, they can see you physically in your office. And then the directed self work, is that in person or is that remote? Can anybody from anywhere access you that way?
Absolutely, yes. So the direct itself can be in person. It can be through a phone call. If you want a recording, I usually do a Zoom call and send you the recording. I don't keep it. I also do weekly meditations as a
Oh,
service to the community, which are posted on my website and are free for individuals. And I'm about to create a podcast so that those meditations, which I've been doing all along for a few years now, are going to be posted on a weekly basis.
fabulous.
On the second Saturday of each month, typically, although this month it's going to be on the third Saturday, I do a deep dive conversation with people on a metaphysical topic. So the one that's coming up in November is Dancing with the Unknown.
Lovely. Wow. So how do people find you if they want to do any of
The
these things?
website is thedirectitself.com for that.
Okay.
And my medical practice can be, if you go to the website, MJFishburn MD.com. That's the medical practice. While I do lab, some educational stuff through telemedicine, most of that is hands-on in person. So
Terrific.
I would love to work with anybody who's interested in exploring either or both.
Thank you so much. Now, often I give people a piece of homework for the week. Do you have any suggestions for a well-being activity that any of us could think about this week or something they could practice in their clinical practice? What homework do you have for us this week?
My homework would be when you find yourself feeling stressed or that internal voice, that internal judge that we have is squawking. If you can just take a slow, deep inhale and really experience the expansion of your belly and ribs, just really work on making it a deep inhale. Pay attention to your posture as you're doing that. And then on exhale, purse lip, blow out. So as though blowing through a straw, just blow out. And give thanks for the moment. Give thanks for the oxygen that you just received. And see if you can't connect with your feet on the ground. Just allow yourself to be present.
Love it. Thank you so very much, Dr. Fishburn, for joining us today. This was a fantastic conversation, and I really appreciate you coming to talk to us.
Thank you so much, Delia. It's been a real pleasure to be here.
All right. Thank you all so much for listening. I'm so glad that you keep coming back, and share this with your friends. Anybody that you think might benefit from hearing about Dr. Fishburn's work, please share. And I will see you next week. Bye.